My name is Rachel Maweza, and I'll be taking you through anxiety brain zaps, which are also called brain shivers, vibrations, tremors, among other names. These are simply electric-like shocks in the brain, which feel like the brain is vibrating or an electric current has been passed through your brain. So what causes um, such vibrations or shivers in the brain? Firstly, chronic stress. Chronic stress not only affects the levels of neurotransmitters in the body. Neurotransmitters are simply messengers that carry chemical signals or messages from one neuron to the other, or from one neuron to another target cell. They actually help in the functioning of the body. So chronic stress gets to affect the levels of these neurotransmitters. Not only that, it also affects the functioning of the neurons and nerve cells themselves. So chronic stress, also called stress response hyperstimulation, causes the overexcitation of these neurons or nerve cells, which may lead to brain zaps or brain shivers. Then secondly, medication. Medication has been reported to cause brain vibrations or shivers in some certain types of medication, like anti-anxieties and antidepressants, among other medication. As patients are taking them, side effects have been reported. The side effect of brain shivers has been reported in some patients. However, also, when withdrawing from such medication, some patients tend to experience brain shivers or vibrations. It's also because of the changes in the levels of these neurotransmitters that I just talked about. So what do you do to get rid of the brain vibrations or shivers? Because it can be very disturbing. Others think they have a brain tumor or something very serious is actually happening to them, when in fact not. In the case of anxiety brain zaps, what do you do? So firstly, you have to reduce on your stress levels. I've explained what chronic stress can do to cause those brain zaps. So you have to do what you have to do to reduce on your stress levels. If it means reducing the hours that you get to do a certain particular activity, if it means taking breaks. Secondly, it will be very helpful for you to go for therapy. Get yourself a therapist to guide you through how you can reduce on your chronic stress, or how you can manage yourself and your day-to-day activities. Because if you do not create time to manage yourself, to manage your health, to manage your stress, illness will force you to make time for it. And so get a therapist or go for therapy. Also, to address the core problems that you may be facing. All right. Then secondly, if you suspect that the medication that you are taking is what is causing your brain, you to have brain zaps or brain vibrations, approach your healthcare providers, approach your pharmacist, approach your medical doctor, and explain to them what is happening. Then they'll guide and advise whether for you to continue taking the medication, or to switch you or to change the medication that you're taking to another medication that does not have that as a side effect, brain zaps as a side effect. Then the fourth point is, do not discontinue medication abruptly. So if you are withdrawing from a particular medication, you have to ensure that the discontinuation process is complete. So mostly the dose is tapered, meaning it gets to be reduced over time when you are being weaned off the medication. So as that is happening, and also because of the changes in the levels of the neurotransmitters, people tend to experience brain zaps because of these changes. And so you may experience that as a symptom as you reduce on the as you are getting wind of, or as you reduce on the dosage of the medication that you are taking. But do not stop abruptly. Ensure that you are guided by your healthcare professional, your pharmacist, your doctor, among others, on how you can wean yourself properly and completely for your own good and to avoid other dangers as well. Ensure that you eat healthy as well, because food, whatever we take in, gets to affect us in so many ways. Lastly, I'd like to assure you that if what you're experiencing, anxiety, brain zaps, anxiety, tremors or vibrations, they are not dangerous. They are not dangerous. They are short-lived. And once all the things that I have talked about have been addressed, you get back to functioning well without experiencing the brain zaps. Thank you so much. Share the message, share the word.